Oh my gosh, I was just
Hi,
thinking.
everyone. Oh, yep, Libby.
I'll keep going. I got the waiting room.
Okay, thank
Yep.
you.
Emily, Nadine,
Hi,
Rosie.
everyone. Yes, seeing lots of folks coming in too. Good to see so many faces. Hi, everyone. Happy Wednesday, I believe it is. Yes,
Hard to
happy
know.
Wednesday. Good to see everyone. Welcome to today's coffee chat. We are going to go ahead and get started. I know we're just a few minutes past the top of the hour. Thank you for bearing with my technical difficulties as we're getting started. But I'm very excited to be with you all today. So just a quick reminder, we are here together on Zoom, and a quick reminder about the Zoom features. So I know lots of us are probably pretty used to several virtual meetings anymore, but there's the reminder that there's chat. We'll use chat throughout. We'll definitely be hearing some wonderful insights from Roger and Karen, but we'd also love to hear from you all. So please engage with us via chat throughout. There's also live transcript and captioning right down there at the bottom, so you can click that if you need it. And then also reactions and raise hands. So that's also down there as well. All right. And then moving on, I also just want to give a quick reminder about adding your Zoom registration to your calendar. So for certain meetings, such as like this meeting, the coffee chat, or some of our other engagement opportunities, you'll have the opportunity to register, and then you'll get the email come through from Zoom, but then you'll need to add it to your calendar if you like to use the calendar. So just wanted to give a quick reminder there. You can see, so this is just a copy of the email on the left-hand side, and about halfway down, you'll see the little links that say add to your calendar. So I know it looks very tiny. I'm just trying to kind of give you a visual of where in your email. So for instance, you all are here today, so you would have received that Zoom email. And so if you look about halfway down, you'll see where it says to add to the calendar. And then on the right, I just made it a little bit bigger so you can see what that looks like. So you can add it to whatever calendar type that you'd like to. So just a quick reminder there, as always, continue to reach out if you need anything, but just a reminder, especially for, we'll talk about engagement opportunities later on. For some of those, it'll often be through the registration process. So just reminding there. All right, and then these are, again, our agreements that I know that we have discussed and agreed upon together. So just a quick reminder here, you can see them all on the screen. But today, I think we should lift up being both teachers and learners. I think that's a wonderful one. We'll hear some really wonderful work that's going on by some of your fellow members, and let's commit to that. Let's teach each other and also be open to learning as well. All right, well, let's start with some introductions. We have a really wonderful turnout here today. I'm so glad. For the sake of getting through everything that we'd love to for our coffee chat, if you all wouldn't mind chatting in your name, location. I see some chats coming in already, so thank you all so much. But in the spirit of letting each other read through and remember where everybody's at, what everyone's up to. So your name, location, and then happy summer. Where is your ideal vacation destination? So we'll give it just a minute for y'all to think about that. Chat in your ideal vacation destination. I know I would love to maybe go somewhere. I've been watching on one of the many streaming services. I think Stanley Tucci is like in Italy or something like that. Yes, if anyone's seen, it's been so good. So I'd love to go probably to Italy at some point. That would be an ideal vacation destination for me. And I see some other ones coming in here. Rodney said New Zealand, Janice, Alaska or Norway. Let's see, Nadine, Paris. All right, see some really good ones. Lots of y'all are chatting in here. Thank you all. Keep them coming. And please do look at chat so you all can read through and respond to each other. All right, so we are going to dive into, and I love it. I love seeing many things coming into chat. Keep it coming. We are going to dive into our agenda. So for today, we're going to hear specifically from a few of our PFA network members on some activities and experiences that they are involved in. And as I said, as they're speaking, if you have questions, you can definitely put them into the chat. We'd love to also have some discussion here in a little bit, but we're going to get started with Roger. And right now, I am loving seeing everyone's faces, but I'm going to stop sharing so that as we have some discussion, we can see each other. So I'm going to, so everyone can see each other. Libby, can you just confirm the slides are gone? Okay, good. Thank you. All right, wonderful. So Roger, I am going to turn it over to you. Would love to hear a bit more about you getting going with all of us. And I know everyone here on the call would just love to hear about what you've been up to and how it's been going for you. So I will pause, Roger, turn it to you, and we'll open it up to any discussion or questions in just a few moments.
Wonderful, thank you. So everybody, Roger here, LaCoy, Des Moines, Iowa. Um, so it's been a crazy couple of months. You know, I had a recent death in the family, so it's been a little awkward. But we move on, and we are the living, so we have to keep it going. So things I've been doing. So you know, I do some stuff with PFCC partners, and I do some stuff with ATW in Chicago, and at home here in Des Moines, I sit on a couple of boards as a consumer representative or a patient representative. I sit on the board of directors for a consumer community health center here in Des Moines. Also, it's a wonderful position to be in, to be able to share my experiences and in that capacity and helping change. And it's all about working together. And when you're on a board of directors, or you have to you have to look at all aspects, everything. It's not just how it's running, it's the funding, it's the people, it's the security, it's the staffing. There's so much to it, but it's so good to be part of that and being able to share my experiences there. And I've been with them now for 9 years, and they just renewed me for another 3 years. And it's definitely an honor. And some of this stuff, I got into this many years ago when I first found out I was HIV positive back about 30 years ago. And when, they started doing consumer advisory boards way back in Massachusetts. And I was able to be part of that. So that's where my sharing and learning career started many, many years ago. And 35 years later, here I am. So besides the local stuff, so I'm doing in one temp, which is about Jesus, doing end of life planning, which is actually a pretty good program. And I know you can't say too much about things because of the confidentiality, but I think it's working out great. They took a lot of the input that the patient advisors were talking, and they're putting it into action. So it's going to be something good to see within the next couple of years when they do bring it and roll it out, and how it's going to be. I'm on another one with through HEW House which is Community Health Center 2035, and that's through uh, to that's through HRSA, I think it is. And that one has been pretty good. It's been meeting regularly every like 4 months. And the concept that they're doing here is they make you imagine that you're in 2035 and what you're going to need in 2035 to be able to care for the people and everything then. So they start there and they make you work back. So in 2030, an example is in 2035, there's going to be AI. So it's like, so what do we got to do 5 years before 2035 to make it ready for then? And then it's stuff like, well, we got to make sure that AI is safe and stuff like that. So the way they do it is really, it makes your brain work. But it's coming up with some of the greatest things that I've ever heard. And it goes all the way back because they want community health centers to start doing this now, start preparing now. And if we do the things now that we know we're going to need in 5, 10 years, it's going to help. So that one's really interesting. It gets my blood's boiling sometimes. Um, and then let's see, I'm doing that one and that one. Oh, God. So then I'm doing one that well, I'm drawing a blank now. So anyways, about all of us, which so all of us was, I was looking around and I like doing what I'm doing. And so I try to look for, I seen this thing that says opportunity to be part of something, something big. And it's like, oh, let me read up on this. Excuse me, my dog is so it's like, let me read up on this. And I started reading and it's like this, it's gonna take 1 million people from all over the country volunteer for this. And it takes your life and your everything about your life and your health and they get really into it. So what they do is it's a program, they're looking at the health of everybody, these 1 million people, and how they take your DNA, they take your blood, they take everything. So they want to get you, they want to know everything about you, and it's all put into this big computer. And then so the hopes is that they get so much information from people that when they tally this all up, they'll be able to look back into this and say, well, yeah, here's an example of these 25 people that had this same thing. This is what they did to help this, and this is what they do, and it's going to help in the future because they're going to have all this data. So you have to agree to, like, you have to let them do your EMR, if you have X-rays or stuff, you have to let them do this. And it's all because they're going to use every bit of this information. It's not going to be sold. It's not going to be anything else. They're going to use every bit of this information for good and for to better health outcomes. So it's been, I just finally, I got the last of my consents done. They've already they're sending me out a thing for my saliva. They want to get into my health records. So, I've been HIV positive for 32 years. I've had so many experiences over these years, uh, health experiences, good, bad. And so all of this information that I have is not going to go to waste, when I die, because I'm going to give it all away. And it just feels so good that I'm able to do it. And I'm not worried about my privacy or somebody getting they're not going to take my social security number or anything like that. I'm not worried about that. I'm feeling good about doing this. It's just, and like, my brother died, and it's just, there's something to share about that. He lived, he had cancer, he survived it, he lived 5 years, and he went again. But there's something to learn from that. And if everybody can, if people can share this stuff, it's sad, yeah, but that's how people grow and people learn, and that's what it's all about. And I just found out myself I have a lesion that they're gonna have to do a bone scan on, and so it's like, I'm looking into the computer. I'm saying, wow, where can I find information about this? And they're gonna have stuff like this, and it's just a great opportunity to share and really give, and that's what I liked about it, and that's why I joined it. Yeah, it's pretty cool. But thanks for letting me share.
Thank you for sharing, Roger. You're involved in some really great things. Something you shared earlier that I think would be a great exercise for a future coffee chat, to think about future state and think about, what we might need. So thank you for sharing everything. I do see Nadine has had her hand up. Nadine, did you have a question for Roger?
Yeah, specifically, please.
Yeah, go ahead.
Raj, who's sponsoring this 1 million man thing? And is there a website?
Yeah, I actually got it up, the website up now. It's called All of Us Research Project, and it's the National Institution for Health that is sponsoring this.
Oh, okay. Thanks, Rod.
You're welcome.
Do others have any questions or thoughts that you'd like to share with Roger? I see lots of things in chat. Feel free to come off of mute. Love to hear other voices as well.
I have one more thing. Can I sneak in?
Absolutely. Yep. This is a discussion for us all. So absolutely.
Raj, the whole time you're talking, and really every time I see you, I'm thinking 32 years, 30 plus years. Do you ever feel like the HIV movement, I'm saying movement, forgive me, it's not the right phrase, has reached its pinnacle? I mean, you never seem to tire. You're always the betterment of, I mean, how do you keep that fervor?
It's yeah, it's been a long time, but
Yeah.
yeah, things are turning around within the HIV community. I mean, God, they have a pill now you take once a day, and it stops the virus, and it stops it in its tracks, and it allows your body to recoup it a little bit, and it does. It's things have turned around, and I should have been dead 30 years ago. They gave me 2 years to live when I found out back in '92. It's like, I should have been dead a long time ago, but I survived, and I've been helping and sharing and doing what I can ever since, because it's not just a gay disease, or it's not just anything. It helps. It hurt everybody. It reached everybody. But thank God. I mean, it took them 40 years, but now they have something, and yeah, we're moving on.
But
Thanks,
I
Raj.
think, uh, Nadine, I agree with you. I've just been astounded with the progress that the AIDS movement has been able to make. I mean, it's been a relatively short period that the disease has really become under control. I mean, women who are HIV are giving birth and not passing it on, and it's just phenomenal. And I think to me, I always look at the AIDS movement, and I too call it a movement. I don't know if that's wrong, but the response to AIDS, the community of AIDS, I guess, I always look to that as such a leader in the concept of what patient-family engagement can really get us to. I mean, it's just, it was completely driven by people who were affected by it. And so there's a lot of good lessons for us to take from the AIDS movement and bring into our work as well. Excuse me. Anyway, Roger, you always amaze me. You're just, such a gift to this work and your vision. And I appreciate how you address the privacy concerns, because, when you're speaking about giving all this information to the National Institute of Health, like my question is, can you get it back? How do you access it for information to inform your own care decisions? And I appreciate your transparency of, that may be a concern for others, but for you, it's not. It's doing something. And lastly, as someone who also just lost my brother unexpectedly, I'm so sorry that you did as well, because it really is a, oof. Yeah.
It's
I'm glad,
sad.
but we're both here today to share the day. So thank you, Roger.
Amen. Thank you. And my condolences.
Okay, I see Janice and Nancy. I also believe your hand is up as well. So, Janice, do you want to jump in? And then Nancy will go right to you next.
Sure. I just want to say thank you, Roger, for your years of work, and probably being around the same age. I first heard about GRID, back in 1980 or so, before it was called AIDS. And, I lost a lot of people I knew. And how so much of the movement, and it was a movement, was because the whole community rallied around it. In San Francisco, if you look up the history of it, and I mean, literally, they went into the mayor's office, and there was a lot. And then they actually, some of the leaders became politicians, and that's when some of it was changed. But they did go to the White House lawn, and we had the big quilt. They had a quilt that filled up the whole. Us that are older remember that. It's worth looking up, AIDS quilt. And I just want to thank you. And I want to say that all of us, I have a couple friends that are serving on some of the committees, and one of them is on the diversity and inclusion committee, but they have just started, like the last couple months. They now are giving your information back to you. So they didn't do that before. So people that do get involved now, they will inform you if you have, something that you'd like to know about right in your genes, something that, it could be a BRCA or whatever, but BRCA you'd probably already know about. But that's taken years of advocacy within the All of Us movement to be able to get that done. So thank you for your work, Roger. Appreciate your sharing.
Thank you, Janice. Nancy, I'll turn it to you.
I just clicked on unmute. Did I show up?
Yep, I see you
Okay.
and I hear you.
And my buddy next to me is my housemate, Wendell. When I register for Coffee Chat and other events, this question is always there. Do you have any questions for the presenter? And I either just go zooming by, pardon the use of the word Zoom, or I just will say, no, not at this time. But one occurred to me today because of what's going on in my personal life. And I would like a lot of attention to be devoted to how various clinics, practices, everything else related handles requests for same-day appointments and how they deal with rescheduling people. I had a crazy nightmare happen yesterday. It's I'm sure we all have our examples as to what seemed really, whether it was unfair or unthinking, that somebody's using a cookie cutter approach. And I know the driving thing with medical people being in short supply. I add the question, when you talk to teenagers, and how many of us don't even do that at all, do you encourage them to go into helping professions? So I'm kind of like peeling the lid back for some future discussions, but it was hot and heavy when somebody said, we're calling to make your, advise you of your appointment on July 3, that part wasn't bad, at 8 a.m. I don't go anywhere at 8 a.m. for appointments. And it turned out they've made some kind of mistake, because the time that I wanted to, or was planning on going later in July, I got a confirmation of it sent yesterday morning. So I have detective work to do for that.
Yes. Well, Nancy, thank you for raising that up. I think we can definitely add something along the lines of, overcoming some challenges that we've all no doubt experienced with our healthcare. So I appreciate you lifting that up, Nancy. Victoria, were you going to say something?
Yes, I am. I'm still looking for my little hand.
No worries. I saw you come off mute, so jump in.
Thank you. You know, Nancy, to touch on your first question, what about encouraging people to join healthcare? I come from a small town of about 4,000, a county of about 10,000, and I cannot tell you the number of people that are children or siblings of current hospital healthcare workers. And several of our physicians actually grew up in the community, or several medical students have grown up in the community. So I can assure you from my end, as far as representing a small group of people, definitely encouraging people to enter the field. And yes, it is very difficult. I feel for you. So, but I just wanted to share that. Thank you.
Thank you, Victoria. Okay, well, this has been some really, really wonderful discussion. Roger, thank you so much for being vulnerable and sharing with us. It was just really tugged at my heartstrings, I know for sure. So I really, really appreciate it. And for all of you, thank you so much for sharing as well. It's great to have a discussion. That's what these are, coffee chats, so we can come together and chat with each other. So I'm going to move us forward. I am going to do my best to reshare the slides. And then Karen, I'm going to turn it to you, but there's some really great stuff, and Roger, some really wonderful comments for you in chat. So I hope that you will take a look in chat, and others keep them coming, anything else in chat, but I'm going to go back to the slides, and then Karen, okay, I think they look okay, right, Libby?
Yep, there we go.
Perfect. Okay, so Karen, just let me know when you want me to move forward. I just have them right now. So if that's okay, just let me know when you want me to move along.
Thank you. Yeah, I have a few slides I'm going to be sharing today. And I really want to call out Libby. And Libby, thank you. You moved me to another level once I joined your organization. And then I began to see your logo and your backgrounds. I'm going, huh, I need to do that too. So that's how this has transpired. And this presentation I gave to the NIH and Office of Women's Health. And it's a matter of getting our information out there, but we needed a background, we needed a focus. So that's what this is. If it wasn't for this network and this group, and I've learned so much from everybody, I wouldn't be where I am today with DES info. People sharing means a lot, and I've shared a lot. But also sharing links. Janice, you shared today, all of us, NIH.gov. So I'm going to have to look that up. When we share things like that, after we're done, I then go on and do some investigation, and that really helps. But people don't understand that DES syndrome is a rare disease. And so I started working with the Rare Disease Network and so forth. So next slide. So these all came about so I could promote our DES Awareness Week in April 2024. And this was sent to the media. Anybody I sent this out to. You have to spread the message far and wide. Next slide. For those who are not aware, DES was given with very different factors. It was given as an anti-miscarriage drug. That's what my mother took. And she was on the Smith and Smith regime. But look at the other people that were exposed. It was given to women to dry up their breast milk. In particular, in Scotland, there was some legislation and an apology to the mothers that were giving the babies up for adoption and developed cancer. They were developing cervical cancer and breast cancer. It was given as a morning after pill. And this really came poignant to me when someone reached out to me, and I run the ES Info Association, and I'm doing that just about every day. But one lady called and we talked, and she's also a nurse, but she was raped in Germany when she was in active duty in the 1980s and given high levels over what the prescribing one was for DES. And she has since suffered cervical cancer and breast cancer. And the last piece, to stunt the growth in young girls, it was called the Tall Girl Project. It was given heavily in Australia and New Zealand. And some of those ladies came to the United States and met with us. That's great. But all of a sudden I started hearing in the middle of this country, Chicago and other areas, it was given to young girls here in the United States as well. And they're having trouble with their ovaries. And they're now at increased risk for breast cancer because DES is a carcinogen and a tetragen. We honestly, and when I put out my notice for this, we don't have an exact number. We don't know how many people were exposed. We're thinking, they kept saying 10 million because we had 5 million take it as a mother, then we have, the children. Well, it doesn't include these other populations. And now it's gone into the third generation. We have no numbers on this. So I'm always planting seeds to try and get research and the information out. Just before we got on this call, I had an initial telehealth call with a GI doc. And I was hoping I was going to make it. And she's a sweet young thing. She was lovely. I can say that now because I'm an older nurse. And we started talking about this. She says, well, I heard one little thing about this in medical school. Yeah. And I was like, well, when we get off, I'll send you my pamphlet. So yeah, we have to plant the seed. We have to, the education, because the physicians are not aware of it. Next slide. This is where I tell my health story, and many of you heard me say this in our different meetings, and I'm not going to belabor that here, but I always like to tell the story, and our 3 different meetings on telling the storytelling were wonderful, and I appreciate that. That was a great initiative. Next slide. this is something that I have to bring to the forefront to, and this, I had to share this with the NIH, and they knew it, but physicians aren't aware of this. They know that we're at risk for reproductive cancers, breast cancers, but look at all these other things that we are at risk for our in utero exposure. I talk to people about this, every day. So what are we going to do? Are the doctors really looking at this? Are we getting the appropriate screening? So we have to keep this to the forefront for the new conditions. Next slide, please. So my mission is education of the medical staff and healthcare providers, encouraging research. I tell you, the money's drying up. And this past year, a colleague and I wrote Caring for the Exposed Patient, and it's been well received. I'm pushing for something in the electronic medical record, the EMR, and I just put a glimpse of all the different genes that we know that were affected. So if we could do a study in the epigenome, that would be great. Next slide, please. Okay, you can take the slides off. Thank you. So I couldn't be where I am today without my association with all of you. I gather so much information. And then the different committees I've been on. So historically, I'm a nurse. I'm a healthcare consultant. I've worked with hospitals for 30 years of compliance to healthcare standards and Medicare COPs. But due to my health journey, I had to take myself off the road. So now what do? You've helped fill that. I have enjoyed every one of our sessions. You've put me on my journey to do more things. I began working with the National Academy of Sciences, and then that opened up some more things. Then I found out, now, how many of you know about ICD codes? So that's for billing, ICD-10 codes. There isn't any for DES. This is convoluted thing and doctors can't find it. So this past, in June, 1st of June, I was able to submit some codes to the CDC and the NIH for their consideration. And I dearly hope they will consider it because it'll make it much easier for the DES exposed. So each thing that we talked about can give me another idea as to how we can move this forward. Working with the Yale and the different engagement opportunities, the work group for social determinants of healthcare work group with Yale. It's a way I've been involved in quality metrics for many, many years. So it's another way of bringing this out. And don't you know, I will always mention DES, what we add to that. So I'm the squeaky wheel. But you have to be the squeaky wheel. And Roger, you've done a great job. We have to be the squeaky wheel to get this information out. So after we finish this, I will be sending my pamphlet to my GI doctor who learned a little bit in medical school. But we have to speak up for ourselves. No one's going to do it for us. And for our population, it's not only women, it's the DES sons, and they've had problems as well. Problems with infertility, reproductive malformations, the DES grandsons, hypospadias, and that's when the urethra comes out of the atypical spot of the penis. We're seeing third generation issues, so we just have to keep this alive. And that's part of who I am and what I do, and why I'm so thankful to be part of this group. I've learned a lot. I've learned from you different stories you're sharing, and I hope that I'm making a difference. Questions for me?
You certainly are, Karen. I see Nadine's hand. So Nadine, I'll turn it to you for the first question.
Yeah, well, I'm going to rattle off 2 or 3 real quickly to her.
Okay, go ahead.
I'll handle it.
They're almost yes/no questions. Karen, as you know, I'm a DES baby as well, and I could
yes.
and I'm a 3-time cancer survivor. But the way I look at it is, my mom lost 5 kids between me and my brother, and if she didn't take that, I can't be upset about the aftermath because I wouldn't even be here at all. So I kind of always took that presence of mind and approached it that way. Not that I'm so noble or anything, but really I wouldn't be here. I always put my hands on my hip. I made it, But I wanted to, you so quickly touched on this, unless I wasn't paying attention, but I certainly was. The EMR, it's not my EMR. I tell every doctor.
Electronic medical record. No, it's not. And when I'm any of the committees with CMS, I'm going to ask for that. please put 2 questions on the electronic medical record on your system. Are you DES exposed? Or do you have a family history of DES exposure? So when I go in for my mammogram, I don't have to write DES daughter, it's in the EMR. And then we get some data collection. And then if we get the ICD-10 codes, we'll get more data collection.
Of course, how many mothers actually told their children that they took that, you know, who
That
knows?
was very hard, especially with the sons. We knew in 1952 with the Dykeman studies that DES was ineffective in preventing miscarriages.
Well, oh wow, wasn't it stopped? It's so counterintuitive. You take it for the morning after pill, but you're taking it to hold pregnancy.
Isn't it? Yeah, yeah.
I'm not even a clinician, but I can see the disparity in that. EMR, I've asked every doctor I've come in contact with, have they been trained in it at all? And doctors like from my generation, or maybe one more generation after, yeah, well, I've heard something about it, and that's comforting. I've heard, you know, with their head like, anyway, so not blasé, just I think so, you know. What about today's medical students?
They're barely getting anything. And this one doctor, she was young, she was so sweet, and she couldn't tell me exactly what she learned. I approach physicians a little bit differently, and I have some pulmonary nodules that are being evaluated, so I'm going to see a new pulmonologist. And I said to them, I says, tell him I'm going to have a question for him on DES. Of course, I come in with my paperwork, and he says, well, there was one question in our exam. It was, I think, cancer of the vagina. I says, well, yeah, that's one of the many things. And then I give them the education and leave the pamphlet with them. I never leave without my pamphlet.
Can you send Libby that pamphlet so we can look at it?
Sure.
Thank
Happy
you.
to. And I might have put it on our network forum page. Libby, did I do it there? Yeah.
I think you did, yeah. And we're going to be
Yeah.
talking a little bit more about the forms in just a minute or two. But
So mornings are very busy for me. I'm getting ready for our meetings here. I'm doing a lot of medical research. What articles are out there for my healthcare business. So sometimes I come across things like HIPAA, and I can put those on the forum. And if that's something you're interested in, because this is information that you don't normally get access to, that I happen to play in every day. So if you're interested in that, I'd be happy to keep putting things on the forum.
Thanks, Carrie. Karen, I always enjoy listening to you.
Thank you.
Janice, yep, go ahead, Janice.
Hi, I saw
Hi.
Karen in another venue recently, so we
Yeah.
commiserated both being DES exposed, but I agree, and I'm very, you know, the differences of health systems are so different, and I have an integrated health system where it's all connected. And recently, when I had my annual visit, my doctor said to me, and she was a new doctor, right? She's the head of the residence, and she said, oh, we don't, you know, you're a little bit different in the mammograms and your age. I mean, not the mammograms, I'm sorry, the you know, the pap smears and in your age because you're DES exposed. You know, I mean, she said it to me.
That's
So
wonderful.
yeah, I mean, and that's in my record somewhere. So I don't see it, but that's, you know, that's because I'm in the same system, right? But it was doctors ago that documented it. So because we have found recently, I think Karen mentioned it, that as well as when I was young, a lot of people had cancer very early. I once worked with, there was 3 of us waitresses working in the same place, and we all were DES from different parts around the nation in Vermont. How weird was that? Like, I've only met a handful in my whole life. But anyway, and they had a lot of issues. But we're also finding now that people in our age, 60s and 70s, are having problems. And so it's a matter of it being documented. So thank you, Karen,
Right.
for sharing. And I'm so impressed with your ICD code. I look forward to it.
Thank you. With getting ready for my new doctor, we have Epic for the health system I'm in. And so I went through the whole laundry list of things we can add. And in there, I've got my DES daughter stuff. So that's always there. And I will always say, well, I'm a DES daughter. Do you know what that is? And I will always do an intro with that.
A lot of young doctors don't know about it because, like I think you mentioned before, that people think it's passé, but it still was given into the 70s.
Yes, it was. It was
So-
given even later in early
Other-
80s in London and England and France. I've been working with researchers in France as well.
Right.
But if we don't speak up for ourselves, who else is going to do it? So feel empowered. Everybody has your own story, and I've enjoyed them, but it's powerful to share those stories.
Right. And we do know now that it didn't help miscarriage. So that's what I used to say, exactly what Nadine used to say.
Yeah.
I wouldn't
yeah.
be here unless my mom told me. I wouldn't be here unless. And so I watched a movie about it and just told her about it when I was in college. And then she told me, honey, she broke down in tears. I've been wanting to tell you you were exposed, you know. And so I had abnormal pap smears, had to have them, you know, every 3 months when I was younger, but it
Yes.
didn't lead to anything. But yeah.
Yeah. There is a movie in the works. A good friend of mine has written a movie called Wonder Drug. And we keep thinking it's going into production. I helped her with some of the logistics because as I said, I'm an older nurse. So what was it like in the 70s? And yeah, so I'm hoping that gets produced. Hope I get to the red carpet for that.
I hope so too, Karen. Definitely. Invite us all. We'll come with you.
Yeah.
Well,
It's
thank you
interesting
all.
when you.
Yeah. Oh, go
One
ahead,
more
Karen.
thing, Brittany, it's interesting when you're with a group, and thank you, Janice and Nadine for coming forward. It's interesting to say, one of my lead-in is, are you DES exposed? Do you know if you're DES son, DES daughter, or DES granddaughter? And people go. But it's a matter of bringing that forward, and that message in our sessions really helped me with that. So thank you. You've been doing some great work.
Great, thank you, Karen. And I was actually going to say, I'm going to go back to our slides. And Karen, thank you so much for sharing and for your passion and for kind of giving us a bit of a roadmap for how you've been going along your journey and ways that you're advocating and sharing your story. And the first question we have here to open up to the full group is a piece of helpful advice you would share with your fellow patient family partners when it comes to getting involved in different efforts, or just any advice. And Karen, you shared something that I thought was a great lead into this discussion for us all, is around, it's important to share your story. And, Karen, you've really been doing that with what you just shared. So others would love to hear. Karen, you're on. If you have a piece, and Emily, I see you. Feel free to come off. Oh, you're off mute. So thank you so much. Why don't you kick us off with that first question, Emily?
Well, what I would propose is not for everybody. I want to admit that, but I have gone on Substack recently, writing and podcasting. It's a free platform. You can write on there. It's an excellent place to share stories, and you can slowly work your way up, learning how to write. Invite a few friends, getting some feedback, and then as you become more confident, just learn how to share your story with wider audiences of people. It's just an easy way to practice writing your story and sharing it. But this one thing I would offer anyway.
Thank you. That's wonderful.
I'm wondering if, Emily, would you drop the name of that program in the chat, please?
One of the things I've started doing, I read Med Today and different articles, and sometimes it's even the New York Times, and they've got something that it may be apropos for me, and I will write a comment. And I can even attach some of the research articles to that. But again, it's bringing it to another audience.
That's wonderful. That's a really great idea, Karen.
Also, I would say, when you see an opportunity, apply for it. That's how I think most of us that are pretty active, that's what we do, right? Like recently there was an opportunity for a quality forum internationally on Twitter, and there was 6 days to apply to be on a panel, right? I mean, that was short. I did retweet it. It was like the 7th of June to the 13th of June, it closed, right? I was like, whoa, that's really short. I don't know. Anyway, and so I retweeted it. I didn't get a lot of people following it, but I thought, how many people really saw this unless they were inside on the forum? So
Did we discuss, Libby and Brittany, didn't we discuss, partnership for quality membership, PQM?
Yes, we have discussed it in the past and definitely
Awesome.
that's an option as well. Yep.
I just
this is-
submitted my application. I was down to the last day and went, because sometimes you get so many emails and I said, have I submitted it yet? And they went, no, you got today. I went, okay. And off it went. Because they want us, they want the patients, they want our experience. It doesn't matter that I'm a nurse. They want me as a patient and an advocate.
And so I think if you don't mind if I jump in here real quick,
Please.
Brittany, I think that it's a really, I don't know why my name is Elizabeth. I only get called that when I'm in trouble, so I don't know what I did. But Brittany, did you change it? I'm in trouble.
I know when you joined, I was like, oh, we're formal today.
No, I must be in trouble somewhere. Anyway, I think that what you're speaking to, Karen, is the number of engagement opportunities coming from new and more diverse projects and organizations. Whether it used to be pretty standard that it would be a health system or a national quality improvement program, looking for patients and families to have input. And now, in the last 5 years in particular, we've really gotten involved with measurement development, which is what the PQM is. And research used to be confined only to PCORI, right, at Janice? And so now we're looking at many other funders that are looking for research and research partners, not research subjects, but partners. And so that's the work that a lot of us are that we're doing. And poor Brittany, I don't know what happened, but as soon as she came on, we suddenly had a dozen new engagement opportunities. So those are going to keep rolling out from us as well. I think what's unique about the way that we distribute those is that we get them from so many different entities, and so we'll just continue to move those out. And as long as we can keep filling them with PFAnetwork members and continue to expand the compensation piece, I hope that you will all continue to be not only active yourselves, but bring others to the PFAnetwork so that we're hearing from newer voices and we're learning together about, and they can benefit from your experience in this effort. So that's a really critical, essential piece of this community.
Thank you, Libby. Absolutely. Sal, I see your hands up. You can, yep, there you go.
Okay, here I am.
Are you?
I'm glad I showed up. This has been
Me too.
fascinating. And the first thought I thought about my sisters, all these, pregnancies in the 60s, and I thought about my nieces, and I said, holy, and then the issues that they were developing, as they got older, not knowing any of this. And so I'm listening to this, and I said, right now it's Tahoe and it's summer and everybody's gone, but I said, I'm going to throw this out here to our coordinator at our PFAC here at the hospital to put this somewhere on the agenda, for when we get back together again. Is this an issue here? What's going on? What's the scuttlebutt? I haven't heard anything, but that's just me. And I think it needs to be talked about. You know what I mean? I really do. So thanks an awful lot for this. Has been very, very learning experience. And I'm glad I showed up.
So glad you came too, Sal. Sal and I had a chance to connect earlier and we talked about it. So glad to see your face again today, Sal. Karen, were you going to jump in and say something in response to Sal?
Yeah, any speaking opportunities I'd be open to. And it was interesting. I spoke at UT Southwest, which is a big medical school here in Dallas. And when I started talking about the changes of the Hoxa genes, those young students, their ears were just kind of like, what are you saying? So there's lots to be shared. And I'm also concerned with our country's focus on abortion. And being a DES daughter, I had 2 ectopic pregnancies and I had a near-death experience. And I read these stories from these patients that are being denied care for critical health needs for them. So I have been starting to post New York Times and so forth. Don't forget the DES exposed, because we're at risk.
Yes, Karen, thank you. And Sal, thank you. And Michelle, I see your hand is up as well. Feel free to jump in, Michelle.
Well, I wanted to introduce myself a little bit, but so Michelle Barone. And on the other side, being I worked in healthcare for 10 years, director of patient family center care, ran 6 family advisory councils, pediatric and adult. I cannot tell you the difference and the change that it made in our healthcare system to have our advisors so involved in everything. Unfortunately, it's not the same in today's world as it was in 2018, before the world changed. But everything from let's test out our hospital beds and the chair next to the hospital bed and mock rooms and walking through, and we even had our pediatric advisory council helping us. The input that we got from everybody and the way that it changed everything in the hospital, everything, because of all of you, those that give of their time and show up and speak their truth. It matters. It matters. We had a discharge class for our heart patients, and readmission rates went so low that they got awards, and now that stopped. And of course, the readmission rate has gone up. It's so important. It's so important. And it's taken me a bit to come out of my somewhat, I don't want to say retirement, but my hiatus. But it's just nice to be here and know that you all have kept it going, even though they locked the advisors out of the hospitals. I'm glad to see that it's still been happening virtually, because it broke my heart every day. And so I want to say thank you to Liz and Brittany, and just finding you guys. And I kept getting emails and just wasn't ready. And so I'm here, and I'm glad to be here. And so thank you for having me.
Absolutely. And I'm glad that you're here, Michelle, as well. I think, and that's the beauty of the PFA network, is people find us when they need us, and they move on when they don't, and they come back, and they, it's all up to all of you. It's what you get out of it, what you need from it. And we just sit here as an inclusive community. That's our job. Thank you.
Thank you, Libby and Michelle. Thank you so much. I'm glad you're here. I know we've just recently had a chance to connect, and so it's so wonderful to see your face here in Coffee Chat. So thanks for being here.
Of course.
Okay, friends, we have just a few minutes left. So what I'm going to do is move us forward. So we were just talking about Karen sharing, your information, your pamphlet. We're talking about engagement opportunities. And so I want to bring us back and remind us about our PFA network forums. So first, I'll bring this up. If you have your phone with you, you can scan the QR code. This will bring you right to the website. I think Libby will drop it for us in the chat as well. But just a reminder that we have this community online, and I think we've maybe gone through just a little bit of a lull, but I think this is a wonderful time. We've had some great discussion and engagement today. And in our last few coffee chats since I've been here, and it's been so wonderful to connect with you all. And so we'd love to kind of reinvigorate this forum community, because it really is a great opportunity for us to connect. So what I'm going to do really quickly here is stop sharing the slides. I'm going to bring up the, okay, let's see, reshare. Hold on just a moment. Okay. All right, I believe I should be sharing, this is the website. So this is our PFAnetwork website. So different from our PFCC partners website, if you have visited that one. So there, just want to make that distinction that there are two different sites. So this is our space, our PFAnetwork site. And so right up top, you can see from the home screen, you can see forum. And so I'm going to click on forum, and that brings us right here to this space where there are opportunities, as you can see on the top right, to post a new topic. So you can post for discussion if you have a question for the group, if you have opportunities that you'd like to share. So one of the things you can see here right in the middle, and I'm going to go to that in just a second to make sure we get through our agenda, but you can see engagement opportunities. So if you click on that, and Janice, thank you. I know you've been active recently sharing some opportunities, so I appreciate that. But you can click here and see some different opportunities that are open and available to our community. So we're also trying to make sure we include those in the newsletter, and that we are sharing on Coffee Chat, as I am about to right now. And we can go into forums more, but I just want to give that reminder that we do have this dedicated space for us all to be able to use. In chat, I uploaded the forum instructions, but again, from the link, if you go to the, I want to say it's the top right, it'll say to either log in or you can create a new login if you've never used it before. It's very quick and easy. I think you just enter maybe your name and email, pretty straightforward, and then you're there. So we'll continue to talk about it. Please reach out to me if you need anything or have any questions as you're trying to get going on the forums. But we'll continue to talk about our forums. But we want to just remind you all that this is a wonderful opportunity to be able to engage. So really quickly.
And Brittany, if I could just add one quick thing about the forums, important to note that because it's an inclusive environment where everyone is welcome, you should have no expectation of privacy. Just wanted to make that disclaimer.
Thank you. Yep. Nope. Thank you for reminding me. Thank you so much. Okay, so we do have two engagement opportunities that I want to share really quickly, and Libby will also drop those links for us into the chat. But there is an IHI patient feedback interview opportunity. It's about 45 minutes of your time, and there is a stipend available for this. And so IHI, the team is looking at what they're calling patient flow, or the notion of how healthcare organizations can ensure patients receive the right care at the right time in the right place. So I believe probably everyone here could contribute and share something about that. So if you're interested, you just email Jeff and just let him know you're interested, and Jeff will further coordinate with you there. So that's about 45 minutes of your time for an interview. And then we have one more right now that I want to share from our partners at Acumen, and they are doing some plain language testing. Also another interview. This one is only about 15 minutes of your time. And so we're looking at the post-acute care setting here. And so our partners would like to know if you have experience with these settings. And again, this is for this particular one, if you've worked with us with Acumen, it's for Medicare beneficiaries or family members or caregivers of Medicare beneficiaries. And then if you also have experience with either of these post-acute care settings. So inpatient rehab facilities, long-term acute care hospitals, skilled nursing facilities, or if you're not sure, it's okay to say that you are unsure. That is an option on the link. So there is the, also Libby will drop for us, you can register for that as well. These are also things that we'll post to those forums. So you're able to see the information there, and it will also come out in our newsletter. There's different avenues to sign up, but we'd love to hear your voices. As we've learned today, it's so important. So Janice, I see your hand is up.
I just wanted to clarify something. I was serving, I'm not sure if I'll be on again next year, on the post-acute care and long-term care within PQM, right, who this is for. So I just want everybody to be aware that when they do apply for these, if you are on this, you have to disclose this if you ended up on that TEP, that specific later, like you're being interviewed here, but you're helping to the development of it is what you're actually doing. And so if you are on the TEP, because specifically within just this one specific group, you just have to declare it and then they decide if you can vote on it. It does not mean you're not on the panel, but you might not just vote on a couple of the measures. So if any of you voted, any of you what is called the PAC LTAC PQM, long-term acute care, if any of you applied for that, I just want you to be take that into mind. So thank you. It's a little bit different than NQF used to be. Yeah.
Okay. Yep. Thank you so much for sharing that information, Janice. All right. And then I also, oh yeah, Libby, go ahead.
Brandy was asking if you could show the previous slide.
Oh, sorry. Yep, sure can. Sorry, I'm clicking and it's like taking me the wrong way. There we go. This one, Brandy, the IHI. Okay.
And the link, Michelle, for the patient flow is Jeffrey's email address. You can just send him an email.
Yep, and just say you're interested.
Perfect. Thank you.
Let him know that you heard it here, if you would.
Yes, please do. All right. Any other questions? As I mentioned, we'll also be sharing these as well. So don't feel like you had to read every word and get it down. We'll make sure to share these out. And this is also just a little bit about each of those post-acute care settings, which I can also post as well. All right, so the last slide is, as always, we had a really wonderful call today. And so this is just referring a friend or someone you know that, would benefit from being here with us. So I think there's one more link. Libby, did you get that one? The membership one, I think I put it here. I'll drop it in really quick. But this is just to share. I'm like, where is it?
I think the easiest is just to send them to the website too. That's the survey where we get a little bit more information. And you guys are always so great about helping people to find their way to us. And I so appreciate your efforts. You all are leaders of the community, and definitely we want to just keep opening it up more broadly.
Yes, we do. Absolutely. Well, thank you all so much. Rosie, thinking of you. Hugs to everyone virtually. Roger, Karen, thank you so much for sharing your voices today, and everyone for being with us. So take care, reach out if you need anything, and we will talk again next month. Take care, everyone.
Thank
Bye.
you.